Good evening, everyone. Shall we start the session?
Yes, we can start the session.
A warm welcome to day two of the National Online Webinar on World Breastfeeding Week 2025. Myself, Dr. Amna Gafur, House Surgeon of Kaumara Britya Department, Government Ayurveda College, Tripundra. This 5-day academic celebration is organized by Kerala University of Health Sciences, School of Fundamental Research in Ayurveda, in association with the Department of Kaumara Britya, Government Ayurveda College, Tripundra. Today's session will shine a spotlight on how Ayurveda supports lactation across different maternal stages, specifically preconceptional, antenatal, and postnatal care. We are truly honored to have a panel of experienced and inspiring speakers with us this evening. Respected Dr. Jyoti P.K. Ma'am, Associate Professor, KUHS SFRA, who will speak on the importance of preconceptional care influencing lactation. Next session, as promised, we will be proceeding by revisiting the missed segment from day one. Case presentation and video on Stanni Pariksha demonstrated by Dr. Geetu Srikumar, House Surgeon at Government Ayurveda College, Tripunithura, guided by respected convener Dr. Shaju M.K. Sir, HOD, Kaumari Britya Department, Government Ayurveda College, Tripunithura. Next session, we will be having respected Dr. Rajida R. Warrior Ma'am, Associate Professor, Department of Prasudi Tandra and Sri Roga, Government Ayurveda College, Tripunithura, who will take us through antenatal care strategies to support lactation. And next we have Honorable Dr. Shahina Mol Ma'am, Professor and HOD, Department of Prasudi Sri Roga, Government Ayurveda College, Tripunithura, who will guide us on postnatal care to maintain lactation. And to wrap up this academic session, we will have a clinical case presentation by Dr. Divya Mol Ma'am, Assistant Professor from Department of Prasudi Sri Roga, Government Ayurveda College, Tripunithura, and Dr. Mary Blossom Ma'am, Assistant Professor from Department of Prasudi Sri Roga, Government Ayurveda College, Tripunithura. We are also deeply privileged to have Dr. Maya Balakrishnan Ma'am, who will be chairing today's session. Dr. Maya Ma'am is currently serving as the Professor and Head of Department of Prasudi Tandra and Sri Roga, Government Ayurveda College, Trivandrum, and also holds a position of superintendent at the Women and Children Hospital, Pujapura. An alumna of Government Ayurveda College, Trivandrum, ma'am brings over 20 years of experience in teaching and practicing Prasudi Sri Roga. She has played a vital role in organizing numerous training programs, CME sessions, and seminars, while actively guiding doctoral and postdoctoral research. She has also served as a member of the Academic Council of KUHS and is currently a member of the Postgraduate Surgical Board. We are truly glad to have Dr. Maya Ma'am with us today for guiding and supporting this scholarly exchange with her wisdom and presence. We welcome you, ma'am. Let me once again welcome you all to our national webinar series, and let's begin our first session. Our first session takes us to the very beginning of motherhood journey, even before conception itself. We are joined by Dr. Jyoti P.K. Ma'am, Associate Professor at School of Fundamental Research in Ayurveda, KUHS. Dr. Jyoti Ma'am has completed her BAMS from Government Ayurveda College, Tripunithura, and her postgraduate degree in Prasudi and Sri Roga from Government Ayurveda College, Trivandrum. With a solid foundation in both clinical and academic field, she has served as a medical officer in the ISM department, followed by over a decade in teaching roles. She has guided several postgraduate scholars and currently serves as a reviewer for peer-reviewed Ayurvedic journals. Her research contributions span crucial areas of women's health, including PCOS, endometriosis, and dysmenorrhea. Let's warmly welcome Dr. Jyoti Ma'am to enlighten us on how preconceptional care lays the foundation for healthy lactation. We welcome you, ma'am.
Thank you, Amna Kapoor. Can you hear me?
Yes, ma'am.
So, respected chair, today, my dear teacher Maya Man and Dr. Shahina Moles, HOD, Department of Prasudhyandra, Government Ayurveda College, Tripura, and all the colleagues. So now, today we are organizing the second day of this webinar, national seminar. So my topic of presentation is preconceptual care influencing lactation. So dear colleagues and also faculties, friends. So coming to this topic, I want to clearly emphasize the importance about this in association with the World Breastfeeding Week. And first of all, we integrate with this UNICEF and WHO, that is the main theme. They give importance to this, that is together they give importance to equal access to breastfeeding support. These two organizations together. Then the main theme of this breastfeeding, that is awareness, is closing the gap, that is the breastfeeding support for all. So when we think of this closing the gap means, three aims are there. Firstly, closing the gap means to improve the breastfeeding support as a critical action. And the gap itself refers to the inequalities or the main deficiencies which every communities of these women they suffer, or they are led by, because even social, environmental, or all the difficulties they are facing. So the main aim is to reduce the health inequity and at last the protecting the rights of mothers and babies to enough to survive. Then coming to the main contents, first of all, we'll dwell with the introduction, then coming to preconception care, then objectives, preconception care in Ayurveda, the influence of epigenetics and its associated factors, the evidence-based research works, then come the conclusion and references. So the preconception care, it refers to the interventions provided before conception. As we all know, its main aim is to improve the maternal and fetal outcomes and to ensure a healthy pregnancy. So when we ensure a healthy pregnancy only, it plays a crucial role in establishing the successful lactation postpartum. The main, it is mainly influenced by maternal, physical, nutritional, psychological, and hormonal health. These all things have to be integrated together, which can be optimized through preconceptual care, because it it should start from the preconception itself. Then it is a continuation going through the antenatal, and then it maintains through the postnatal care. So what is preconceptual care? That is, it is the provision of biomedical, behavioral, and social health interventions to women and couples before conception occurs. It's a definition by WHO, and as we have seen earlier, improving the health status and also the reducing the behaviors that affect the individual and environmental factors. Because these all factors, as we know, we are in this more that is fast moving strata. They contribute to poor maternal and child health outcomes in every way. So the ultimate aim is to improve the maternal and child health outcomes in both short and long term. So the main three objectives are there. as is we can highlight. Firstly, to understand the key factors of preconceptual care affecting lactation. Second, explore the evidence-based Ayurveda interventions supporting the lactation. And lastly, to present the integrative strategies for improved breastfeeding outcomes. So coming to understand the key factors, that is the main thing is that it is not influencing lactation, it is affecting lactation. So the maternal nutrition, the deficiency of iron, calcium, vitamin A, D, B12, folate, etc., which is both very much critical or useful for both pregnancy and milk production. If it gets deficient, then the nutrition that is support will be depleted. So, and the next is to maintain a healthy BMI and the hormonal balance, because we know that the lifestyle disorders, that is thyroid disorders, and also the disorders like PCOS, and a lot of other hormonal interventions interacting with it. This affect the lactogenic hormones, mainly the prolactin and oxytocin. And this wide topic, the mental health, the stress and depression, it is much explained later in the coming slides. And also other factors is medical history and chronic illness, that is the chronic illness, that is hypertension, diabetes, autoimmune disorders, etc. Then also to preconceptual optimization, that is ensures minimal interference during lactation. We have to be it's a measurable approach to correct it. That's the thing. Then breast anatomy, that is identification of this breast related any that is inverted nipples, hypoplastic breast, like that, also retracted nipples, etc. And also with the history of any breast surgery. It will we have to find it and get and find the preventive aspects as how to overcome it. So identification is important in this part. And next is the lifestyle. Lifestyle, that is smoking, alcohol, caffeine, etc. Some data also regarding these lifestyles, so I included it. The next is the explore the evidence-based Ayurvedic interventions supporting the lactation. So that is certain herbal galactose, that is it is evidently proved. It will be further explained in the coming slides. Then also integrative approaches, including yoga, relaxation, and diet counseling. Diet counseling is a very important factor to improve the maternal self-efficacy and also the lactogenic hormones as together. Then next is, that is the third objective, to present the integrative strategies for improved breastfeeding outcomes. So both, that is the two parts is there, integration and strategies. So the integration is combining the clinical obstetrics as where that is to relate these things, that is nutrition, mental health, and complementary therapies. So we have to integrate all of these factors together. And the strategies applied is preconception and screening, mental health care, lifestyle modifications, nutrition support. So coming to our opening the door, that is preconceptual care in Ayurveda. So firstly, remember all the things I interpreted as this objectives, three objectives. And we can relate these three objectives with this, our principles, what all things we have, we are interacting with the preconceptual care in Ayurveda. It is very, very important in this current scenario and also in the future. So if I think it is important for every woman and also the school going children from the adolescent age itself. It should be practiced well. So we are going through the slides. It is already that is explained in the classics. I just included it. So just that is mentioning only, and we will the upcoming slides will have much related data over it. That is Garpa Sambhava Samagri. We all know Ridukshetra Ambu Bijana, like, and also the Apatya Marga, Hidi, Vayu, etc. Then Trivida Bella, Sajam Kalajam Yuktikritam. It is coming that Belavat Desha, Purisha, Kalajanma, Bija Kshetra, Sharira Sambhaja, Sattva Sambhaj, Belavat Kaleja, then Ahara Sambhaj Satmya, Swabhava, Samharsha. So we are integrating these all factors in the coming slides. Then Garbhagara Shatbhavas. It is all a part of this preconceptual care. Madhrijadi Bhavas, Shatbhavas. Then coming to the main components of this Garbhadana Vidhi, that is Panchakarma Shodhana, dietetics, Rasayana, psychological wellness. So first start this Panchakarma Shodhana, then all the diet related factors and also the advice, including the counseling we have to give in this topic, and much more after the Shuddhi, the Rasayana Prayoga. What well is, it is very much proven in our classics by a lot of research related works. And above all, I give importance to the psychological wellness. Then coming to Panchakarma Shuddhi, firstly, Virejana and Vasti. As we all know, it removes, that is the Amatva, that is what we have don't need, what our body don't need. And also I mainly remember our ancestors, because they used to do Virejana even monthly. So this have a very much important aspects in both the health outcomes of in every aspect, that is physical, mental, emotional aspects, etc. Then it balances the pitta and vada doshas. Moreover, the enhancing the quality of ovum and sperm, and relating it with the lactation, it enhances the lactogenesis. Then as a part of this Virejana, what happens is that the Rasadhatu, it will get more purified, and also it will get more rejuvenated, etc. So improves the quantity. As a result, it will improve the quantity and quality of the breast milk and promotes lactation more. As a result, we all know that it directly nourishes the sanya. So from the preconception to the antenatal, then postpartum, it should be continued. Not that is continued means the Panchakarma Shuddhi I have not, that is Rasadhatu. That is, it is done according to the Bela itself, according to the Rogi Bela. Then Vastikarma, it regulates Sabana and Vyana Vayu, and through the endocrine axis, it very much supports the lactation reflexes by having that is the neurological pathway. And you can see the evidence-based research study in the that is below each slides. Then Vastikarma, that is for better nutrient absorption, that gut-brain endocrine axis, and the most important thing we have dealt with this is the gut microbiome, and it enhances the gut microbiota. And what is needed, good bacteria for our body, it enhances by its karma. So next comes the most important next component, Dasayana, which enhances the tissue regeneration, immune strength, mental clarity, and longevity. And Vijita ma'am and Shahina teacher will explain more about all on this antenatal period and also the postnatal period. So I have only noted some of these Rasayana Drivyas. Then combining this preconceptual panchakarma and the use of rasayana drugs, it will have a synergistic effect on this mammogenesis. Through the dhatu poshana, is promote milk augmentation. Then also this rasayana phalakrita media helps. It will be discussed later. Then coming to the main that is importance of this era, and the most that is described topics in all leads, that is medical associated conferences, etc. That is the influence of epigenetics. I'm trying to correlate this the role of not correlating, that is relating the role of epigenetics with this relating to this lactation. So we all know that the quality of gametes, that is, it is influenced by environmental factors, nutrition, and stress, as we have already explained. So the epigenetic markers, DNA methylation, histone modification, that is, it will promote the attraction of these proteins in a simple way without altering the gene mechanism. The gene expression can be altered. And how will we affect, that is, it will get deficient or it will get promoted. That is, we have to see according to our lifestyle factors. I think you are getting it, because the maternal nutrition before conception, it very much influences the offspring's metabolism and also the future lactation potential. So there are some studies relating this, and the third point, I think it is a very important one. And also the Bija Shuddhi, it is essential for a healthy progeny and equated with proper epigenetic programming. And also this, that is histone modification, etc. Then when the proper receptors are, that is vitalized or that is regenerated by this type of factors, that is environmental, both our emotional, psychogenic factors, etc. Then it will be promoted, that is to a very that is positive way, ensuring this mammogenesis. And also the Pumsamana karma, as described in class 6, it also, that is Stiratva of Garbha. It plays an important factor. Then coming the stress and epigenetic regulation of lactation hormones. Preconception stress, it imprints the HP axis, influencing postpartum and also the expression of oxytocin and prolactin genes through methylation. So it can be affected. So we can plan strategies not affecting it and to regenerate it. So I want to stress the factor that is Manasiya Bhava, the mental stress, the status of mother is very much crucial, as discussed in Garbha Sambhava Samagri. The meditation, yoga, and Sattvajaya therapy, it ensures very much. It helps very much. And the detoxification and endocrine epigenetic health, that is the toxins, just I am mentioning is the toxins like BP and phthalates and heavy metals. That is, it mainly mimic the estrogen receptors. And also when it mimic the estrogen receptors, it can affect this epigenetic markers. And also the prolactin and also the insulin-like growth factor, lactation-related genes. Then coming the microbiome and the breast milk composition. The maternal gut and the vaginal microbiome prior to conception is influenced epigenetically by diet and environment. So it can affect the infant gut and the breast milk microbiome, impacting lactation efficacy and infant immunity. That is, we have to, every woman, I think we have to take that very much importance to our gut, take care of our gut very much. And it also these related factors are what is um, emphasized in Ayurveda in different strategies, a different way. That is Agni, Ahara, Dinacharya. All these are related what is called as epigenetics. So the preconception use of probiotic rich ahara and also ultimately it leads to OJS, which can promote the lactational immunity transfer. Then we have see that it's a preconception we use Tila, Thaila and Masha. And I have tried to mention what is all content in it and also what have proven in it. You can see the slides. So due to time lag, I cannot describe everything very detailed. So the Tila, and it is Bella Vrishyan's Sanyavardaka, and in also in phytoestrogens, omega-6 fatty acids, and also the contains the minerals very much that is important for to promote this prolactin secretion and lactation maintenance. Then Tila Thaila. So both external and internal application is maybe used as a part of preconceptual panchakarma. Then they have one important factor is interesting factor also the Tila Thaila, it have the estrogen mimicking activity of sesame. So it also they say it enhances the beauty and neuroendocrine balance. So supporting this pathway that is prolactin oxytocin reflex and ultimately improved lactation. Then Masha. So everybody know that is Brahmaniya, Vilya, Vadahara, its properties. Then to enhance sadhu strength and stanya production. So about the microbiome, gut health, and also leading to stanya sambat. Then the Masha has proven improved fertility and enhanced mammary tissue in test models. That is the research studies are below. So coming to the conclusion, the preconceptual care in Ayurveda lays a profound foundation not only for conception, but also for successful and sustained lactation. For the successful and sustained lactation, we have to go through both this antenatal period and also the postpartum period, which our resource persons in Government Ayurveda College Tripunithura will explain detail. Then by optimal acne and dosha balance and emotional well-being, what we have seen in all these slides, it nurtures our Rasadadu and Sanyadadus, so prepare physically, hormonally and psychologically for breastfeeding. And the Srodha Shodhana, that is the Virejana, that is, and also Vasti, etc. It prevents obstruction in Sanyava Srodhas, thereby facilitating efficient milk flow postpartum. So the holistic approach, rooted in classical Ayurvedic wisdom and supported by the modern research, it marks the importance of comprehensive preventive care model that begins even before conception to ensure optimal lactation outcome. That is the take-home message I have to share to all from this my presentation. So the references are also attached. So above all, Saumanism Garpadharananam Srishtam. I feel it very important from the preconception, from the adolescent age itself. It's a, as all know, it is a very important. So thank you all. So I like to thank my that is SFRA School of Fundamental Research in Ayurveda under Kerala University of Health Sciences, the VC PVC registrar, and my colleagues here, Professor Dr. Anil Kumar sir, who was very much that is initiated by 2 weeks service behind this project, and also my colleague Dr. Sriraj King, who is sharing every my duties here. and also Dr. Sailekha, and my teachers, faculties in the government Ayurveda colleges and all the colleges, and my respected other faculties, PG scholars, all friends. Thank you once again. Thank you.
Thank you, ma'am, for your valuable insights on today's session. The call is now open for discussion. Participants, please unmute yourself and share your thoughts, or you can type in the chat box. Now I welcome Dr. Maya, ma'am, to conclude the session and share her thoughts. We welcome you, ma'am.
Hello, good evening, everyone. Am I audible, Amna?
Yes, ma'am.
Yes, ma'am.
Okay. First of all, I would like to express my profound gratitude to the organizers of this webinar, uh, the KUHS School of Fundamental Research in Ayurveda and the Kaumar Pritya Department, Government Ayurveda College, Tripunithura, especially Dr. Anil Kumar sir and Dr. Shaju, Dr. Sriraj, Dr. Jyoti, etc. In fact, I was not that well today, but still, when I heard who the presenters were in the session, I gladly took up this job actually. And I'm actually very proud, in fact, to be a chair to this session because all presenting are very dear to me, especially Dr. Jyoti. She's one of my dearest students. And today she has done a wonderful job in presenting the key points behind preconceptional care and its influence in lactation. As we all know, preconceptional care is a very unique concept which was laid in the most comprehensive way in Ayurveda. Actually, in our earlier textbooks, in gynecology and obstetrics and all, we could never hear this term of preconceptional care. It is very recently that the contemporary medicine, they have started thinking about preconceptional care. Even then, I don't think it is as comprehensive as what we or how we think about it. Dr. Jyoti has actually, she has laid down the main points like the importance of maternal nutrition, how the BMI influences the lactation, then the importance of hormonal balance, and finally, and most importantly, the importance of maternal health on lactation. There is another thing like we know that all these factors are very important in the way that genes express themselves in the progeny and in many future generations. She has also mentioned about the importance of all these factors on epigenetics. Then there is an indirect effect also. Like if you think about it, you see, if what is the purpose of preconceptional care? It is to make the father and mother most healthy, not only healthy physically but also mentally, so that they bond together and they have a wonderful, they have a dream of a future progeny of future generations. And uh, and when the father and mother are healthy, naturally the ovum and sperm are healthy. And that naturally leads to a very healthy antenatal period with very less morbidity. During this period, during the pregnancy period, there could be a lot of morbidity, which could adversely affect the physical and mental health of the mother. So if the preconceptional care is done properly, then the mother is very healthy, so that in the antenatal period, she is very healthy. And then naturally she will have a normal good labor, and the fetus or the baby that comes out will also be healthy. So in that way, also preconceptional care is very important. So it has an indirect influence in that way also. I think these are the main points that I would like to share. And I think Dr. Jyoti has presented all the key points very comprehensively in a very effective manner. Thank you so much.
Thank you, my dear teacher. Thank you.
Once again, thank you, Dr. Jyoti ma'am, for your wonderfully structured session. Your words brought out the silent power of preparation and how Ayurveda wisely supports motherhood even before it begins. And thank you, Dr. Maya ma'am, for sharing your wisdom, thoughts, and highlighting the key points regarding the session. On next session, once again, I take a moment to sincerely apologize for the technical interruption that occurred during yesterday's session. We thank each one of you for your patience and support. As promised, we begin today's proceedings by revisiting the missed segment from day one, a case presentation followed by a video presentation on Stanya Parisha demonstrated by Dr. Geedu Srikumar, House Surgeon at Government Ayurveda College, Tripunithura, guided by respected convener Dr. Shaju M. K. Sir, HOD, Kaumara Britya Department, Government Ayurveda College, Tripunithura. We welcome you, sir.
Namaste. Myself, Dr. Geedu Srikumar, House Surgeon, Department of Kaumara Britya, Government Ayurveda College, Tripunithura. First of all, I would like to share and express my gratitude towards our beloved HOD to providing me a wonderful opportunity to represent or present a case scenario in this webinar. Thank you, Shaju sir. Name of the patient, Ayan, is a male, 2-month-year-old, informant, mother, OP number 2025007423. The presented with complaints of bloating for 1 week, abdominal colic for 1 week. History of presenting complaints. A 2-month-old mild child, male child born to non-consanguineous parents via LSCS. The neonatal period was uneventful. The child cried soon after birth. There was no birth complications. On detailed inquiry, the mother was found to have unhealthy dietary habits, which includes excessive intake of guru, snigdha, kaba, vardha aharas, such as dietary products, bakery items, instant noodles, packaged food, and fried food. She also has sedentary lifestyles, day sleep, and lack of physical activity. The mother has a history of chronic emotional disturbance and frequent mood variations. History of past illness. No history of fever. The birth history. Prenatal. The mother maternal age was 28 years. Paternal age was 32 years. Birth order 1. Natal. LSCS. Preterm. Cried soon after birth. Postnatal. There was no NICU admission. Anthropometry. At birth, the weight was 2.75 kg. Length is 47 centimeter. At 2 months, weight was 4 kg. Length was 51 centimeter. On examination, abdomen was soft and there was no tenderness. So considering above factors, Sanya Dushti was suspected. Stanya Pariksha. Examination of breast milk. For assessing the quality of breast milk of mother, Jala Pariksha was performed. One drop of mother's breast milk was dropped into a glass of clean water. The milk sank without mixing and settled at the bottom. This is indicative of Kabadushtastanya as per classic Ayurvedic science. This was the demonstration which we done in our OPD. From this examination, we found that Kabadushtastanya is being on examination. The breast milk was found to have Kavadushti, but the signs and symptoms of the baby was Vadiga in nature. Abdominal colic and bloating was presented. On interrogation with mother, it is found that mother is consuming kaba aharas like deep fried foods, bakery items, sweets, etc. And the mother was emotionally unbalanced too. Discussion. The evaluation of the Sanya was Kabadushti, but the signs and symptoms of the child presented was Vadiga. This may be due to faulty feeding techniques. As in more on interrogation, we find it true that mother has some emotional imbalances and she was not being able to feed her child and she was not feeling free to feed her child too. And Tamoguna Pradhana Sattva of mother is also the reason for this cause. Viridahara Bhuktaya Shuktidaya Vijayadasa Pradushta Date Garbanya Stanyam Rogagaram Shishu. This is the reference from Ashtangam Uttarasthan. And the mother also provided not enough milk for the child. So there is a reason for Vadiga Dushti too. Bhojanam Hena Matram tu Balo Bhajaye Ojase Sarvesham Padaroganam Hedutam Chaprabhate. This is a reference from Ashtangam Sutrasthan.
The call is now open for discussion. If anyone have any doubts or any thoughts, please share in the code. Please unmute yourself and share. Dr. Geedu, you can now continue the session. We will now proceed with the video presentation on practical demonstration on examination of breast milk prepared by house surgeons and Department of Kaumara Britya Department. Government Ayurveda College, Tripura.
Excuse me, ma'am, it is not audible.
Madam. No.
Once again, I apologize to everyone. Due to some technical issue, we are unable to play the video. We will try to play this video in the upcoming sessions. Next, shall we move on to the next session? As we progress into the antenatal phase, we are honored to welcome Dr. Rajida R. Warrior ma'am, a respected Ayurvedic practitioner and academician, currently serving as Associate Professor in the Department of Prasuti Tantra and Sri Roga, Government Ayurveda College, Tripura. Ma'am has completed her BMS from Vaidyaratnam Ayurveda College, Ulur, and pursued her post-graduation in Prasuti Tantra and Sri Roga from Government Ayurveda College, Trivandrum. She has served in various impactful roles, starting as a faculty member at RVS Ayurveda College, Coimbatore, and later as a medical officer under the ISM department, and is also pursuing her PhD at KUHS. Her professional contributions are notable, ranging from delivering CME sessions, public awareness class, and seminar talks, to playing a key role in research. She is especially recognized for her work as a co-investigator in Madhurjam Antenatal Project. An inspiring teacher and mentor, she has guided several postgraduate scholars, nurturing both their academic and clinical excellence, which truly highlight her dedication to women's health. We welcome Dr. Rajita ma'am to share her insights on today's session on antenatal Ayurvedic interventions can help prepare for a healthy breastfeeding experience. We welcome you, ma'am.
Thank you. Am I audible? Hello? Hello? Am I audible?
Yes, ma'am, you are audible.
Yes, ma'am.
My my screen is visible now?
It is visible. It is visible.
Okay, okay. Namaste to all. First and foremost, I would like to express my sincere gratitude to all the coordinators of this online seminar, especially Anil Kumar sir and Shaju sir, and all the other coordinators for inviting me to present this on this topic. And also, I would like to extend my heartfelt thanks to today's chair, the respected my teacher, and the Shahina teacher, our HOD, and all the colleagues and the esteemed audience. Since the preconceptual care has already been discussed, now I proceed directly into my topic without further delay. Thank you. So my topic is antenatal care to support lactation. Is the slides are moving now? Changing? Hello? Hello?
Yes,
Yes,
Rajita.
okay. Oh, yes, yes. Thank you, thank you. So going to the contents, the introduction and the benefits, risks and challenges of breastfeeding and the breast care, nutrition, and some scenarios. These are the topics which I am planning to discuss. As part of introduction, the antenatal care. Actually, the antenatal care includes mainly major two parts. That is, one is antenatal examinations and then comes the advices. So antenatal examination, that can be concise to a single slide like this. The essential investigation examinations at each visit include weight and BP measuring, abdominal examinations, fetal heart rate or a hearing and urine test, edema check, per vaginal examination if indicated, ultrasound, dating scan, anomaly scan, and growth scan, respectively in the first, second, and third trimesters, and all the blood tests, HB, blood group, VDRL, HIV, HbSAg, glucose tolerance, etc. under the examination. And then comes the advices to the mother, the nutrition, high protein, iron rich, calcium rich diet, iron folic acid, calcium supplementation, tetanus injection, rest and sleep, danger signs like bleeding, leaking, swelling, headache, decreased fetal movements. All these things can be considered as a danger signs to report immediately. And the breast care, nipple hygiene, inverted nipple correction if needed. And the birth preparedness, the place of delivery, transport, and finances, avoiding alcohol, tobacco, and other self-medication. All these include under the antenatal care in the contemporary science. Now, coming to the Garbhini Paricharya of our Ayurvedic part, it can be considered as in three phases. That is, in the first phase, the antenatal care mainly aiming at the Garbha Sthabana till the 12th week. And the Anga Pratyanga Nirmana. All the antenatal care is mainly aiming at this. And the second phase, it can be considered as Garbha Vridhi, where the nourishment and the growth of the fetus is made as a main aim. And the third part will be the preparation of for prasava and the stanyapana. So this comes on the third trimester. Like that, Garbhini Paricharya will can be divided into three phases. So coming to the antenatal care to support lactation, we can consider that antenatal period is the ideal period to prepare the mother. And the counseling, breast care, and the nutritional advice are the key elements to be considered in this antenatal period. So supportive environment also lead to the better breastfeeding outcomes. Coming to the importance of breastfeeding, it is already discussed in the previous previous day seminar. Is a WHO recommendation exclusively breastfeeding up to 6 months. It's advocates exclusively breastfeeding for 6 months. And the long-term health benefits for baby and mother is already discussed in the last day's session. And the role of antenatal education in promoting early initiation of breastfeeding. That is our area. So the counseling, that is the first part that ensures that ensure the assurance and the preparedness for the mother for mentally for the breastfeeding. And she must be explained early that breastfeeding should start early within 1 hour of birth. There's a golden hour. She has to be informed that the benefits of positioning and the demand feeding, and her fear and myths, some false beliefs has to be addressed. These are coming under the counseling part. Now coming to the breast care in pregnancy, the cleaning with plain water and avoiding soap, nipple massage only if needed, avoiding unnecessary manipulation. These all things has to be informed to her. And the nutritional support for lactation. The importance of the balanced antenatal diet is very, very important, that including iron, calcium, protein, and the fluid intake as the part of diet, and the supplements if it is as per the guidelines. The physiology of lactation and the hormones, these are things are to be kept in mind. And the development of mammary glands during pregnancy, all these things will be explained a little bit in the upcoming slides. And the antenatal breast assessment is a very important part, assessing the breast and the nipple shape condition, and the detecting flat or inverted nipples, the teaching simple techniques for the correction, and identifying any previous breast surgeries and the anomalies. That is also very important in the antenatal period itself. Coming to the birth preparedness and the breastfeeding, there's always a planning. Now most of the deliveries are as conducted as institutional delivery. So rooming in and skin to skin contact it can be applied to every mother. So involving the family members in the lactation support is also becoming an important part. The Sudhikagara, our area, which in the Sudhikagara described in our Ayurvedic text, actually ensures the privacy. Actually, coming to the first part is the counseling, discussing the benefits and risks and the challenges. The maternal benefits are in the part of the physical health. It fosters the uterine involution. It reduces the postpartum bleeding. It promotes the weight loss, lower the risk of breast and ovarian cancer, reduce the risk of type 2 diabetes, lower the risk of hypertension and cardiovascular disease. In the reproductive health, natural contraception, and the psychological, it's improved maternal infant bonding and reduced postpartum depression. And economically, it is very cost effective. So all these things are all the benefits of the breast milk should be conveyed to the pregnant lady, so that she must be wholeheartedly inclined to the breastfeeding. There are some risks also. The continuous breastfeeding may lead to sore nipple, cracked skin, breast engorgement, mastitis, and breast abscess due to improper latching or positioning, blocking of the ducts, infection, and may require drainage or temporary cessation from the affected breast. The breastfeeding increase the nutrition demand. It requires additional 300 to 500 calories and plus protein, calcium, and iron. And breastfeeding may lead to some sleep disruption and fatigue due to the frequent night feeds. And inconvenient lack of support may be there in the social or workplace. And some of the some medical conditions may be exacerbated due to the breastfeeding. Now going to the common reasons for denying breastfeeding. that has to be addressed in the antenatal period itself. There are medical, infectious, maternal, infant-related, and social reasons. But we have to keep in mind that hepatitis B or C, COVID-19 and mastitis are not solely it is not contraindicated for breastfeeding. The maternal infections like HIV, untreated tuberculosis, herpes simplex, and HTLV infection, maternal medications, chemotherapy agents, radioactive isotopes, antiretroviral therapy, recreational drugs, and the maternal health conditions like severe illness, postpartum psychosis may contraindicate the breastfeeding. Some breast-related issues like active breast abscess, breast cancer with radiotherapy, and some social circumstances may produce a challenge, may make a challenge for the breastfeeding. So most risks we found here are manageable with proper antenatal education and early postpartum support. Breastfeeding benefits generally outweigh the risks. That is why the breastfeeding is generally supported. There is an information that the breastfeeding reduce the risk of hip fractures in mothers later in life. The relationship is a little bit complex and influenced by multiple factors. But the evidence-based researchers find that during the breastfeeding, usually what happens, estrogen level drop and the calcium is diverted to the milk production, leading to temporary bone mineral loss in the early stages. So primarily from the trabecular bones, the calcium is reabsorbed. So this bone loss is actually reversible. So when the calcium support is supplemented, calcium is supplemented, this osteoporotic changes, the osteopenia can be reversible. But some epidemiological evidences, several studies have shown that moderate breastfeeding, 6 to 12 months, is associated with a reduced risk of hip fractures in post-menopausal women. A Norwegian cohort study involving 20,000 plus women found that breastfeeding for up to 24 months were associated with a 28% of lower risk of hip fracture in old age. A meta-analysis also concluded that parity and the breastfeeding reduced the hip fracture risk. That is the main mechanism behind is bone remodeling and hormonal adaptations. So there will be enhanced osteoblastic activity after lactation, leading to improved bone structure. So there is a remodeling of the bones so that it is the osteopenic changes will be delayed. The dietary adaptations and hormonal shifts help reconstitute the bone stores. And the carrying infants may contribute to the bone stimulation and remodeling by the weight bearing and the mechanical load. And the longer reproductive period protects against the postmenopausal blood loss because the lactation delays the menopause due to breastfeeding. Coming to the breast care, these are the antenatal changes in the breast that can be concised in a single slide, like physiological changes. The breast enlargement, tenderness and heaviness may be in the first trimester. The nipple changes becoming that more erect, prominent and pigmented, presence of Montgomery's tubercles. All these are already the textual references. The areolar changes, the vein prominence, and the colostrum secretion that begin from the 16th or 20th week. And the breast preparation for lactation is actually the glandular tissue proliferation, the alveolar development. The both happens in the breast due to the estrogen and progesterone activity. These are the pictorial representation, the gradual changes of the breast. We can see the alveolar and ductal changes in the breast in the puberty, virgin adult, gestating and lactating and involuting. Regarding the physiology, the suckling triggers the sensory nerve endings and that impulses in the areola that will stimulate the brain to secrete oxytocin, and that also will stimulate the lactogenesis also. So oxytocin and the prolactin is also secreted, and that will triggers the myoepithelial cells to squeeze the milk from the alveoli, so it drains into the lactiferous ducts. The milk is pooled in the lactiferous sinus before being discharged through the nipple pores, and these are sucked by the baby. This will again induce a positive feedback. The milk production lactogenesis begins antenatally through actual secretion, though the actual secretion limited until birth, after birth. So the lactogenesis the first part of the lactogenesis happens in the antenatal phase. So there is a clinical implication that in diabetic mothers or twins or unexpected NICU admissions or mother with expected breastfeeding challenges, the antenatal colostrum can be expressed prior, and that can be kept. Conditions that may disrupt antenatal lactogenesis 1, like PCOS, obesity, stress, smoking, or in all these things, colostrum expression can be advised. So in the breast preparation, we can consider this as Grihita Garbhanam Artavahanam Srodasam Vartmani Avarudyante Garbhena. This is a classic textual reference where the channels of that carrying Artava is blocked by the Garbha. It supports the first part, by some part supports the forming the placenta, and the other part support the breast to produce enough milk. And the diet, actually the intake of the food will be intended to develop the body of the pregnant lady, and then the breast development, and then forms the garbhavriddhi. So milk production can be considered as a supply driven, though meaning that the more frequently effectively the milk is removed from the breast, the more milk and the body is signaled to produce. So that in prolactin and the oxytocin, which stimulates the milk production and the ejection, that is mainly supported by the sucking. The emptier the breast, the faster the production. The fuller the breast, the slower the production. The prolactin surge happens every time when the milk is removed. If the milk is not removed, that will decrease the prolactin, and that feedback inhibitor for the lactation, that the protein present in the milk, that will inhibit the production. Some breast conditions has to be addressed in the antenatal period itself. The flat nipples that can be assessed during the antenatal checkup, and that teach the Hoffman's exercise, and the nipple shields that can be advised them to how to the technique. Place both, this is the Hoffman's technique, where the two thumbs are placed on either side of the areola, pressing inward slightly and pulling the thumbs outward and away from each. That can be repeated 4 times. That can be repeated again in the next the clock of changing the position. And the nipple shields can also be used. In the inverted nipple, gradual manual stretching technique that has to be taught to that female, the pregnant lady. There is a condition called hypoblastic breast where the glandular tissue is inadequate. So the milk production will be less. So that should be early identified and counseled. So asymmetric breast can be one of the condition where there might not be that much changes. So reassurance is the main remedy. Some of the previous breast surgeries may, some the augmentation surgeries, or may damage some of the ducts and nerve endings. So that can lead to that decrease of the lactation. Breast trauma also reduce that contents of the breast, and the large breast may produce some challenges in the positioning and the poor latching. So for them, the football halt or sideline positions can be advocated. Breast piercing and tattoo that also may produce some blockage to the ducts. Supernumerary nipples are not posing much problem to the problem, but the reassurance may be given to the mother. Some of the skin conditions are very important. The eczema and dermatitis, if it is present, that should be treated at the earliest as it is identified. So early identification, counseling, referral when needed, and a postpartum support planning, and some of the aids, using the aids are the antenatal helping method. breast size is does not determine the ability to produce breast milk. That is a very important point, that the milk production depends on the number of functioning glandular tissue, not the fat tissue. The large breast or big breast mainly due to this the fat, not the alveolar tissue. But there are certain conditions where the size becoming an important fact, that is tubular breast, where the glandular tissue is less. Coming to the breast adenoma and fibroadenosis, some of these other conditions may be commonly present in the pregnancy that usually does not interfere with milk production or ejection unless very large or blocking. Like fibroadenoma is very large or more than 2, that near to the duct, that may block the duct, that may cause the lactation deficiency. In fibroadenosis, may cause some pain and engorgement. Usually the milk production is not affected, but there is some problem in the latching. So ductal compression may lead to reduced milk flow in the part of the breast. The mastalgia may discourage the effective feeding. The local inflammation also may increase the risk of blocked ducts. And there may be confusion with mastitis if some of the cysts may mimic the mastitis, that may delay the appropriate lactation support. Now we are going to some clinical scenario requiring the antenatal preparation for lactation. The first scenario, these scenarios are clinically relevant, so that the antenatal preparation is very particularly crucial. Suppose the lady is becoming pregnant for the first time. There may be some challenges like anxiety, lack of experience, and lack of confidence in breastfeeding. So they may be educated how the breastfeeding can be done, and the emotional reassurance and the family support, ensuring the family support. That is the antenatal preparation. If the baby, if the pregnant lady identifies that she is having 2 babies, in that case, there may be challenges of fear of insufficient milk. So the high nutritional demand there is on the mother, so that must be ensured in the pregnancy itself. And there is a chance of preterm delivery and NICU stay, that must be informed that there is a chance, and so that they get mentally prepared for that. So reassurance that milk production is supply driven. That when though there are 2 babies, when the baby sucks, there will be enough milk will be produced for every time. So discuss the frequent feeding and pumping plans for them, and nutritional optimization is very much important if there is higher demands. If there is a IUGR baby, that also may require an NICU, and the poor suckling reflex in the initial stage. So they must be taught to how they express and storage the breast milk, and if needed, some alternative feeding methods also to be advocated. But the importance of colostrum, it is very important for their immunity and the gut protection for the IUGR baby. Suppose if the lady is becoming pregnant for the second time and she has the previous history of lactation failure or hypogalactia. In this condition, there may be challenges like she may be psychologically of low confidence, that she fears that this time also she may not have that enough milk. So in that condition, the endocrine details, that is the Sheehan syndrome like PPH leading in the pituitary, what we call as Sheehan syndrome, where there is inadequate oxygen supply to the pituitary gland, there will be pituitary suppression. This should also be ruled out. Sometimes there may happen postpartum depression or mental concern. In that condition, there may be delayed bonding. In some at that time, if she's had the similar event in the previous pregnancy, early mental health screening and emphasizing breastfeeding as a bonding and mood enhancing act, she has to be explained like that, and build a strong support system. In the case of breast cancer, the feasibility of breastfeeding should be assessed, and alternatives has to be advocated, or they should be counseled that some breastfeeding may be needed. sometimes early return to the work that affect the breastfeeding continuity. So in that condition, that expression and storage of milk and the safe feeding practices should be taught to them, and they must be promoted. Now coming to the cesarean section and lactation failure. There is a chance of cesarean lactation failure in the cesarean section. Why it is so? Because there will be delayed skin to skin interactions. So in that case, that interferes the oxytocin release and the milk letdown. In case of post-operative pain and fatigue, that hinders the breastfeeding posture and frequency. And anesthesia and sedation that can cause the alertness in the mother or baby initially, reduce the alertness, and delayed rooming in that will cause the less yearly suckling. And increased medical intervention may separate the separation due to the observation or complication. And maternal stress and anxiety inhibits the hormone response to lactation. So there is a role of antenatal counseling and support, encouraging side lying or football hold to reduce the abdominal strain, monitor signs of delayed lactogenesis, and use of hand expression or breast pump every 2-3 hours if the baby is not latching. Actually, lactogenesis 2, it usually occurs 30 to 72 hours postpartum, that may be delayed beyond 72 hours in C-section mothers. Now coming to the obese and lean women. If the obesity and lean women may have some of the lactation problem due to hormonal insensitivity and breast that these are the factors which the hormonal sensitivity will be normal in the lean women, but in obese there may be delayed prolactin rise that can reduced oxytocin reflux. So lactogenesis is often delayed in obese. And milk volume may also be lower in that case, in the case of obese women, and the breast development in pregnancy is less pronounced. So already the obese women have larger breast. The suckling response is also may face issue because of this obesity, because of poor positioning or large areola nipple complex mismatch. So obesity related factors like insulin resistance, inflammation, sleep apnea, metabolic syndrome, all these may impact the lactation. So pre-pregnancy counseling is very much crucial in these women. Obese women may need targeted lactation support and early breastfeeding assistance. So early initiate skin to skin contact and breastfeeding within the first hour of the birth. That is very much important. Dasadhatu quality and the nourishment is the key of the Sanya Doshni, regardless of the BMI. So even if the rasa quality is not that much good, even the obese and the lean both can have Stanya Dushti and Stanya Abhava. Coming to the PCOD and lactation, there will be elevated androgens that may impair breast tissue development during the pregnancy and can delay lactogenesis too. So the polycystic ovary mother, if she's getting pregnant, that she must be given some of the drugs like Shatavari, Shatapushpa, Lodra, Tribala, both influencing her the insulin resistance and also the also to support the lactation from the later stages of pregnancy. GDM can also be considered as prameha. In that condition also there is a srota or rotha that may lead to the stanya abhava that can be, and the rasadhatu which is formed may not be sufficient to produce enough milk, and that too with good qualities of milk. So there is a prolactin paradox in PCOD and hypothyroidism. We know that PCOD and hypothyroidism, there is increased prolactin, but it is to be kept in mind that not all prolactin elevations are functional. That is enough to produce milk. So prolactin presence is not equal to effective lactogenesis, because there may be due to prolactin needs to surge the postpartum. There must be a surge of prolactin that should be triggered by nipple stimulation and placental delivery. So even if the prolactin is present in the baseline, that may not produce, either increased prolactin may not produce lactogenesis, because there must be a triggering, that must be a surging of the prolactin. So this may be due to desensitization of the prolactin receptors. And poor oxytocin corresponds is also need to, if also makes the milk, prolactin makes the milk, but oxytocin ejects the milk. But in the poor oxytocin corresponds may decrease the milk letting down. So polycystic ovary can also impair the mammary gland proliferation, and the estrogen progesterone imbalance in the that puberty, that will produce some changes in the breast that can also lead to the delay in lactation. In hypothyroidism also, there will be fatigue and low milk output due to sluggish oxytocin response. In polycystic ovary, poor breast tissue development and receptor insensitivity lead to the influence the lactation. So preconception managed metabolic correction and the supplement of galactogogues, latching help. All this lead to the correction of the lactation problem. Coming to the conclusion, lactation success begins antenatally actually. So though the health education, nutritional support and breast assessment, it should be through this health education, nutritional support and breast assessment in the antenatal period. So there are many barriers, but they are modifiable. And with anticipatory guidance and skilled intrapartum care and postpartum lactation counseling. Breastfeeding is not just the neonatal nutrition, it's a maternal medicine, improving long-term bone, metabolic, and psychological health. Empowering mothers with this knowledge, support, and timely interventions can ensure better initiation, continuation, and satisfaction in breastfeeding. So these are the things which we have discussed. There are benefits and risks and challenges are discussed, and the breast care, how it should be done, this is already discussed, and the nutritional needs also discussed, and some of the scenario, the LSCS, PCO, and GDM is already discussed. Thank you.
Thank you, ma'am, for your enlightening session. The call is now open for discussion. Participants, please unmute yourselves and share your thoughts. Ma'am, we have a question in our group. Hello, ma'am. What can be
Yes.
done in the case of high prolactin level causing excess production of milk leading to infection? Shall I repeat?
Yes, just may wait a minute.
Okay.
Yes, repeat that question.
Okay, sure.
Yes, just repeat.
Okay, ma'am. Hello, ma'am. What can be done in the case of high prolactin level causing excess production of milk leading to infection?
Excess milk production is mainly, it is not the excess production, it is not the excess, it is not the correct emptying of the, it is not due to the excess product, it is mainly due to the incorrect empty. It's not inadequate empty. So that is mainly because of the inadequate latching. But any of the reasons the mother cannot feed the baby. So the proper latching techniques has to be advised for them, how to the proper latching technique. That is all the areola should be inside the the baby's mouth, so that there may not be some problems in the nipple. That is that soreness of the nipples. These are the main problem while a baby, a female for the first time getting pregnant and for going to the breastfeeding. So that actually the excess milk is mainly due to the not the excess production, not due to the improper emptying.
Thank you, ma'am, for clarifying the doubt. Once again, for the participants, the call is now open for discussion. Please either unmute yourself or share your thoughts in the chat.
Good evening, ma'am.
Yes,
I am Dr. Arun Gupta from Jammu and Kashmir.
yes, sir.
My question is whether we should advise for breast massage during the last trimester of pregnancy. If yes, what are your insights on that?
Breast massage, you need the nipple stimulation that for the inverted nipple. Actually, the milk massage, the breast massage is not at all advocated if there is a need. Only it's advocated if there is a need. If support, if there is some breast that means inverted nipple or flat nipple like problems, that has to be addressed. Therefore, that nipple stimulation can be done. If that you are asking for the nipple stimulation can induce oxytocin. Likewise, the breast that delivery that can be enhanced. Likewise, you are that is the question you are asking.
Yes, ma'am.
Just
Let me share
to
the context.
initiate the delivery for breast
No, no,
massage.
no,
Breast
no,
massage
no,
is
no.
initiating the delivery.
Let me share the context of the question.
Yes.
In many of the Garbha Sanskar classes, I have seen that in the last trimester of the pregnancy, usually breast massage is advised, or pregnant women are encouraged to breast massage their breasts. My question was contextually related to this: whether what are the benefits of breast massage during the last trimester of pregnancy in terms of lactation?
Yes, that can it is not related to the lactation, it is related to the endocrinology behind. Actually, when there is a stimulation in the nipple, there will be always an oxytocin surging, or it is a stimulation for the oxytocin to be produced, to be secreted in more amount, so that oxytocin may act act as acting on the myoepithelial cells of the alveolar glands, like they can act upon the uterus also. So there is a natural stimulation, that is a natural stimulation from the delivery, that the normal labor initiation, that can be that may be the scientific basis of massaging the breast to initiate the labor. That can happen in the that may be advised in the last trimester. But is that practiced, and that if that is effective is that I don't know that much, because is it effective to induce the labor? That simply giving a breast massage and to induce that labor is, I think it is I am not having that much experience to answer that. So this may be the scientific basis for massaging the breast in the
Thank you.
last
Thank you,
trimester.
ma'am. Thank you. Ma'am, I want to compliment you for this elaborate presentation. It was really very exhaustive. I was not expecting that the clinical scenario part was the best part of the presentation, in which
Thank you. Thank you.
you discussed every condition. I have never listened to any webinar in which such exhaustive elaboration, clinical elaboration has been given. Thank you so much.
Thank you, doctor. Thank you for your comment.
Now I welcome Dr. Maya ma'am to conclude the session and share her thoughts. We welcome you, ma'am.
Thank you, Amna. As for the presentation, Dr. Rajita has done a very wonderful and in-depth presentation on all the aspects related to the effect of antenatal care on the outcome of lactation. As Dr. Arun Gupta said, I think it is Dr. Arun Gupta, my classmate. As he said, it was the presentation of the scenario part was the best, because that is what all are interested in, what to do in a particular condition. That is what most of us do not know. And she mentioned everything like the importance of breast care, nutritional advice, then the contraindications of lactation, etc., etc. As we all know, counseling is very, very important because most of the mothers, first-time mothers especially, they do not know how to do the latching, how to hold the baby, etc., etc. And all studies have shown that proper counseling actually brings out the best in terms of the quantity of breast milk, the self-sufficiency of the mother, reducing the morbidity related to lactation, all that. So counseling is very important. Breast care is equally important, and nutrition also. We all know that the breast milk is anti-infective, anti-inflammatory, contains so many antioxidants and so many antioxidants, etc., etc. And all this is probably all the principal action behind this. It comes from the gut microbiota of the mother. And gut microbiota is influenced or remodeled according to the diet and mental status of the mother. So preparation for this is actually going on during the antenatal period. And that is what all our acharyas have advised with the ahara and vihara during the antenatal period. I don't think I'll take much time because I think time is lagging a bit. As to the explanation that Dr. Arun Gupta asked for, I think as a routine, we do not advise breast massage here. Actually, even all massages are advised only after the 8th month. Usually after 36 to 37 weeks, because we know that nipple stimulation is actually a test, for oxytocin challenge. So we do not advise that. And if massage is done, it should be done in a very gentle manner over the breast, not on the nipples. Nipple stimulation is to be avoided, especially before 36, 37 weeks. But the advantage that could happen is that it improves circulation, makes the breasts a little more pliant so that it is not that hard and firm, especially for primigravid mothers. Other than that, great precaution has to be taken when you are massaging the breast. So it has to be done under supervision because stimulating the breast can certainly lead to the release of oxytocin and cause preterm labor and all that. So it has to be done with care. So I think that's all. Thank you so much.
Thank you. So kind of you, ma'am.
Thank you. Thank you, ma'am.
Yeah, bye.
Once again, thank you, Dr. Rajita ma'am, for your insightful talk. Your holistic and experience-rich perspective on antenatal care gave us all a deeper appreciation of how essential it is to nurture both mother and child during pregnancy and regular monitoring of their health. And she discussed various pathologies with Ayurveda's role, and we are grateful for this well-explained session covering various areas in such a short time. And thank you, Dr. Maya ma'am, for your valuable insights on the session. And now we turn our attention to the postnatal phase, often overlooked yet crucial in maintaining a healthy breastfeeding journey. We are privileged to have with us respected Dr. Shahina Moles, ma'am, Professor and Head of Department of Prasudi Tantra and Sri Roga at Government Ayurveda College, Tripunithura. Dr. Shahina ma'am is a highly respected clinician, educator, and researcher with over 23 years of experience in the field of Ayurvedic women's healthcare. She completed her BMS from Government Ayurveda College, Tripunithura, followed by her MD, and later earned her PhD from KUHS, marking a distinguished academic journey. She has not only led numerous public awareness programs and delivered impactful lectures, but has also mentored over 30 postgraduate scholars and is currently guiding doctoral research as a PhD guide. Her dedication to advancing clinical knowledge is evident in her contributions to peer-reviewed journals and her active involvement in curriculum development and maternal wellness initiatives. Today, Dr. Shahina ma'am will enlighten us on the topic postnatal care to maintain lactation, shedding light on the Ayurvedic approaches that ensure sustained and healthy breastfeeding support for new mothers. We welcome you, ma'am, for the session.
Am I audible?
Yes, ma'am.
Respected Chair Dr. Maya Balakrishnan, Dr. M.V. Anil Kumar from SFRA, dear faculties, Kaumarapatyam HOD, Dr. Shaju, my dear colleagues and dear students, and a warm welcome to the last part of the presentation. Postnatal care to maintain lactation. Who is Sudika? Sude, Suyade, Sudaha. The word Sudika is derived from the basic Sanskrit element su, meaning to produce or to yield. Suda jananatham ashauja sudagam asti yasya sa Sudika. Sudika is said to be unhygienic during the days because of vaginal and uterine secretions. That is lokia. सूदयश्चापि तत्र स्यात् अपराजेन निर्गता प्रसूतापि न सूता स्त्री भवत्येवं गते सति. Acharya specifically says that after expulsion of placenta, the lady gets the name of Sutika. Coming to the different opinions of Sutika Gala, Sushruta and Vafada says 1.5 months as Sutika Kala. Bhavaprakaša Yogaratnara says 4 months and Kashiva says 6 months. Government gives 6 months leave, maternity leave for ladies for according to the Kashiva's opinion. Sustained breastfeeding or 6 months breastfeed, maintaining of breastfeeding is the motto of this year's breastfeeding week. Vigata Sudika Abhidhana Syat Punarartava Darshanat. Commonly, most of the acharyas coming to the concluding the Sudhya Kala as 1.5 months or Punarartava Darshana Kala. After obtaining menstruation, Sudhya, name of the Sudhya is changed. What are the benefits of, what are the changes occurring in Sudhya? Or what are the benefits of Sudhya Parichर्या? एवं ही गर्भ वृद्धि क्षेपित शिथिल सर्व शरीर धातु प्रवाहन वेदना क्लेद रक्त निसृत विशेष शून्य शरीराश्च पुनर्नवी भवति. This is the benefit of Sudhika Parichर्या. That means in changes occurring in Sudhika, शरीर शून्यता, धातु क्षय, शिथिल धातु, अग्निमान्द्यम and क्लेद निर्मिति. Sudhika Parichर्या is based on Deshamja, Jadi, Satnyanja, Sampradharya Prayoji. Garbhashaya Shodhana, Agni Deepana, Vadanulomana, Stanya Pravartanam are the main aims of Sudhika Parichर्या. Garbhashaya Shodhana and Agni Deepana. Panchagola Peya with Gudodagam, Ardraga Sorasam with Madhu,
Medhika churnam with Jiraka and Shundi churna, Shadapushpa churnam, Drona Pushpi Swarasam with Gulodagam, Marija churnam, Tila with Gulodagam. All are helping to enhancing the Garbhashya Shodhana and Agni Deepana. In this time, Ahar itself is becoming Mahapaishajya for Sudhika, which makes impact on the health of the baby also. So Acharya says, Sudhika, Shuddhadi Tailat, Kridadva Amahadim Pipet. That means Acharya first focus on the Agnibala of Sudhika. So advise Tila or Krita according to the appetite of Sudhika. In present era, nobody focus on the Agnibala and consumes heavy food just after delivery. In our traditional food like Ullichoru, Pachila Puttu, drugs like Maladangi, Paruthi, Mukkutti, Perivalam, root bark, etc. can be used to prepare kanji or ada, other food items. Rektashali, etc. Are used to enhance the used in the Sodhika perigeria, which enhances the lactation in mother. In preparation of Ullichoru, freshly prepared shigru leaves on hot rice as a layer, and again put hot rice over it, and salted onion is ghee is added along with the rice, and kept it for some time and have it as a meal. That's the method of using Ullichoru. Uluvakanji is also one of the special meal used in Kerala for Sodhika. Mamsa Prayoga. According to Acharya, Acharya clearly mentions that when to use Mamsahara. Saptaratrat Param Jasya Kramasho Brahmanam Hidam Dadashahe Nadikrade Pishidam na Upayojit. That after 12 days we can use Mamsa Ahara. But nowadays on next day of delivery, people use all types of non-vegetarian foods. So many Mamsa preparations are used traditionally in our Kerala. That's Ajamamsa Rasayana, Kukkuda Mamsa, Idi Marunnu, Koli Marunnu, Attinkal soup, dry fishes, etc. But one of the main drug is Attinkal soup or mutton soup. Prepare in our area with Thanadaram Kashaya Churnam, vertebrae and legs of goat 400 gram for vegetarian, green gram 400 gram, small onion 200 gram, garlic, ginger, cumin seed, clove, jadipatri, cinnamon, fennel seeds, ariyar, etc. Add and prepare Attin soup. Coming to the viharas. These are the common breastfeeding position. Previous presenters are detailedly described about these things. Vihara Abhyangam, oil processed with Haridra, Sudhika Snanam, cold water processed with Triphala or head and body with hot water. This helps to stimulate the pituitary gland to enhance the lactation. Veduguli with Nalpamara, Vashapatra, Amravatra, etc. Udaraveshtanam, Gofanabandha, etc. are advised to the Sudhika. Proper Nidra is enhances the lactation in mothers. Lehya preparations. Coming to the Lehya preparations, we can divide. Sudhika can be divided into Stula Sudhika or Prisha Sudhika. In Karshana type, for Sula Sudiga, Pulinkuramba, Panjajira Gudam, Dengin Pokula, Sopagishundi, Odimarina, Lehingan, Lehia, etc. can be used in for Krisas Sudiga, Vidaria Digruda, Indaganda Gruda, Kalyana Gruda, etc. can be used after 1 month of delivery. For Abhyanga, Thailam, Thanundaran Thailam, Sahajaradi Thailam, Prabhanjana Thailam, Prabhanjana Kudamba, etc. are used. Kashaya, Dhanundaram Kashayam, Kalyana Kashayam, Vidaryadi Kashaya, etc. are used according to the condition of the Sutika. Tadeva apatya samsparshat darsana smaranadabi grahanasya sharirasya shukravat sampravartade. Jarya says about this quotation to the creation of the milk. Nowadays, incidence of postpartum depression also increasing day by day. Here comes the importance of Sudhika Perigeria. Oxytocin, the letdown hormone is strongly influenced by the emotional state. Stress, fear, or anxiety can inhibit milk ejection. Supportive environment, that is partner, family, or caregiver, improves maternal confidence and milk flow. Postpartum depression can negatively affect bonding, feeding, and frequency and milk production. Feeding frequency and milk production. Skin to skin contact and early breastfeeding help reduce maternal stress and enhance oxytocin release. Relaxation techniques, deep breathing, gentle massage, music therapy promote a calm state, aiding lactation. Pathyao Sudiga, Prasuda, Hidam Aharam, Viharam cha Samajare, Vyayamam, Maithunam, Krotham, Chida Sevam Vivarjayet, Sarvadaha, Parishuddha, Tat Sniktha Pathya Alpa Bhojanahi, Seda Abhyanga Paranityam, Havet Masa Matandrita. These are the classical quotations and traditional medicines which are most commonly used in Kerala. All of these things says that Rihi Moolam Avatyanam, Srihi Rakshati Rakshitaha. Thank you.
Thank you, ma'am, for the insightful session. The call is now open for discussion. Participants, please unmute yourself and share your thoughts. Now I welcome Dr. Mayama to conclude the session and share her thoughts.
Thank you, Anna. Dr. Shahina Mol, she has done a very good presentation on the effects of postpartum care on lactation. She's my very dear colleague and an exceptional clinician and gynecological practitioner. She has laid down some very unique preparations in the, especially very traditional preparations that are used for postpartum care in Kerala, especially, and all the other classical preparations also. We know that it's said that about the number of organisms, microorganisms ingested by the infant is about 10 raised to 8 cells, which include fungi, bacteria, etc., etc. And actually, the colonization of the human milk, that is the constitution of this microbiome of the human milk, is actually not clearly understood even now. Earlier, it was believed that it was from the skin of the breast of the mother or from the oral cavity of the mother. But research has shown that it is also the human milk microbiome very closely resembles the gut microbiota of the mother. And how this gut microbiota gets into this human milk is something of very great interest, actually, because it said that the dendritic cells, they actually disrupt the intestinal epithelia, catch up the live cells from there, bacterial cells from there, and colonize them in the mesenteric lymph nodes. And from there, it is transported to different parts of the mother. And likewise, it's transported to the mammary glands also. And from there, it gets into the milk, and from there, it goes into the infant's gut. So you see, it's very important, and that actually controls the long term and short term. And this microbiota actually influences the immune and metabolic status of the infant, and that goes to control the short term and long term health of the baby. So all this, that is the preconceptional care, antenatal care, and postpartum care, are all very important in deciding the health of the baby. So I think that's it. Thank you, Dr. Shahina. It was a very wonderful presentation. Thank you.
Thank you, ma'am.
Thank you, Dr. Maya ma'am, for your remarks. And thank you, Dr. Shahina ma'am, for your thoughtful and in-depth session. Your emphasis on sustained care, diet, regimen, and also emphasizing on rejuvenation of mental and physical health in the postnatal period with Ayurveda's role brought a sense of completeness to today's theme. Now, we have a video presentation on diet advisable for Sudhiga to support lactation, which will be presented by Prasudhi Tandra Department of Government Ayurveda College, Tripunithura. Please proceed. We sincerely apologize for the technical issue. Now, to bring all this knowledge into clinical context, we have a case presentation by two vibrant academicians, Dr. Divyamol MD ma'am and Dr. Mary Blossom ma'am, Assistant Professor from Department of Prasudi Sri Roga, Government Ayurveda College, Tripunithura. Their session will offer practical insights into clinical conditions seen in Ayurvedic practice. We welcome you, ma'am.
Thank you, Dr. Anna. Am I audible?
Yes, ma'am.
Okay. A very good evening to one and all. Myself, Dr. Divya, and let me start with sharing the screen. The slides are visible, right?
Yes, ma'am.
Okay, thank you. So, before starting the session, I would like to extend my gratitude to Kerala University of Health Sciences, School of Fundamental Research in Ayurveda, and Government Ayurveda College, Tripunithura, for this wonderful initiative and opportunity as a part of World Breastfeeding Week celebration 2025. And it is also really encouraging to see such a vast gallery of participants here, gathered here from different parts of the country. So without any delay, let's start our session. Before starting the session, I must say, I am currently running with a fever at the moment. So if any inconvenience is causing due to that, I apologize for that in advance. So in this session, we will discuss a case report which was reported in the immediate postpartum period of a breast pathology. So I think let's don't do the conventional way of discussing a case here. Instead of starting with the diagnosis, let's start with the patient particulars, then history, presenting complaints, examination, investigation, etc. And based on that, let's try to arrive at a diagnosis. So as participants, your part in this presentation is to conclude the diagnosis. So we request your active participation in this presentation. So our patient, Mrs. A, was of 26 years old and she was a housewife. She just had a full-term normal vaginal delivery. The baby was female of birth weight 3.1 kg and she cried immediately after birth with a good ABGA score. So coming to the presenting complaint, her main presenting complaint was blood stain discharge from both breasts during the initial breastfeeding attempt after delivery. We know in cases of normal vaginal delivery, we encourage the patient to start breastfeeding within 1 hour. And in case of cesarean section, we encourage them to start the breastfeeding as soon as she regained her consciousness. So in this case, she noted the complaint at the initial breastfeeding attempt after delivery. So the history comes like following delivery, the mother was supported in initiating breastfeeding by the attendees. But initially, breast milk did not come out, which may be due to poor latching technique. Then another attempt was made within 5 to 10 minutes of first attempt after completion of her episiotomy suturing. So at that time, a reddish brown discoloration of the colostrum was noted. And associated findings like pain, swelling, or fever were absent. And also the findings like nipple cracks, trauma, or purulent discharge from the nipple were absent. And no history of previous breast disease or high-risk antenatal condition from the history of the patient. So coming to the obstetric history, she was primipara, just had the delivery with an uneventful antenatal period. Her labor was of spontaneous onset at 38 week plus 2 days. And she delivered vaginally without any instrumentation. No PPH was reported and episiotomy wound was sutured under local anesthesia and the wound was healthy. When discussing about the general examination, all the parameters were normal except for the factor that slight pallor was there. So coming to the examination of the abdomen, in the first picture you can see the uterus is firm, well contracted just below the level of the umbilicus, which was immediately following the delivery, and she was not complaining about any distension or pain in the abdomen at that time. So in the second picture, you can see again a firm, well contracted uterus, which is 2 finger breadth below the level of umbilicus, which is on day 2 without any complaints of distension or pain. So her complaint was in the immediate postpartum period, but added the picture of examination of abdomen on day 2 for your reference only. And coming to the examination of perineum, no undue bleeding per vagina was noted. The bleeding was within normal limit and vulval hematoma was absent. Episiotomy wound was healthy and healing was showing. So coming to the important part, which is breast examination, breast engorgement was absent and nipple was of normal shape without any retraction, cracks, ulcers or fissures. And areola was normal without any abnormalities. When discussing about the local signs, there were no tenderness, mass or lymphadenopathy. And to correlate with certain condition, we checked the temperature of the patient. She was febrile. Then coming to the important finding, which was the discharge, which was of thin in consistency, reddish in color, reddish colored mixed with colostrum, which was coming from both breasts. So as you can see in the picture, you can see the reddish colored colostrum coming out of the nipple, which was reported in the immediate postpartum period within 2 hours of delivery. So to exclude certain condition and to arrive at the final diagnosis, judicially picked investigations were advised, which were CBC, complete blood count, C-reactive protein, CRP, breast ultrasound, and lastly, cytology of milk. CBC was normal, as you can see here, except HB was at a normal level and CRP was normal. On breast ultrasound, lobular hyperplasia was there without any breast cyst, solid nodule or enlarged lymph nodes. As we know, the changes like lobular hyperplasia and ductal ectasia are normal for a physiological change of a lactating breast. And coming to the cytology of milk, RBCs were present, epithelial cells were present, but most importantly, no malignant cells were detected, which indicate benign condition of the disease. So coming to the differential diagnosis, mastitis was excluded because the condition was not associated with fever, pain or tenderness here. The ductal papilloma was excluded because the presentation was of bilateral symmetric presentation without any evident mass. And nipple trauma was also excluded because here in this case the nipple was intact without any cracks or bleeding as you saw. And malignancy was also excluded because in the breast USG also no lump or any suspicious pathology was evident. Also in cytology also the cells were normal except RBCs and epithelial cells were present. So coming to the final diagnosis. So can anyone guess the diagnosis? Anyone from the participant? Would anyone like to suggest the diagnosis here? You can unmute yourself and say the answer, or you can put it in the dialog box also. What may be the diagnosis here? So say I am not able to see the chat box. Dr. Amna? Dr. Amna?
Ma'am, no one has replied in the chat box yet.
Okay. So let's describe about the diagnosis here. The condition was benign, physiological in nature, and which was a very rare condition. And the condition occurs due to elevated vascularization of rapidly developing alveoli and mammary ducts. So what is the peculiarity of the vascularization that is happening here? The capillaries are very delicate and which is fragile in nature. So it can easily traumatize, resulting in blood cells leaking into the blood secretions. So the diagnosis was rusty pipe syndrome. The diagnosis was rusty pipe syndrome. As we discussed earlier, it is a condition that is happening due to rupture of fragile capillary network which is surrounding the alveoli and mammary ducts. So this condition, most of the time it is self-limiting, but the care should be taken if it persists beyond 7 days. So according to Ayurveda, what we can correlate? We may correlate the condition with Pittaja Sanyadushti, Abhighadaja Sanyadushti or Sanyota Jara. Why Pittaja Sanyadushti? Because from the Lakshana, we can see that there is the color change like Tamra Babasa and Gandha change like Rudra Gandhi, and also according to Acharya Kashyapa, Rekta Abhasa has mentioned. So based on the Lakshana, we may correlate the condition with Pittaja Sanyadushti and also Abhighadaja Sanyadushti. Why? From the Nidana, we can say Susruta has mentioned that Abhighada Padana Pidanadikad, due to Padana or Pidana, etc., causes of Abhighada, it can cause Abhighadaja Sanyadushti. And Acharya has mentioned the treatment should be same as that of Vadaja Sanyadushti also. And there is one more condition which is Stanyota Jara mentioned by Acharya Kashyapa and Khalastana, where Acharya has mentioned that Jara due to Udbhava of Stanya can happen. So there one important statement has been given by Acharya, which is that Sahi Piyusha Samshuddho Krama Matrena Tishtadi. When the Piyusha or breast milk get cleansed or Samshuddhi, that Jara can stop spontaneously. So we may consider this is an Adiyoga Avastha of Sanyota Jara also. These are only possible correlation and some other opinion can also be there. So coming to management, when it's come to the management, it is very important to give the reassurance to the mother about the benign nature of the condition, because in the immediate postpartum period, if we see blood mixed discharge from the breast, that can cause some panic situation, not among the parents but also among the practicing physicians if we don't know the diagnosis. So this is not a condition where breastfeeding is contraindicated, even though in this condition, formula feeding was advised until the result were available. And meantime, we encourage the mother for frequent breast milk expression to prevent the chances of breast engorgement and thereby mastitis. So in the previous session, Shahina ma'am has already mentioned that when we approach a Sudika, Samanya Sudika Chikitsa is there. We have certain principle to treat the Sudika based on Samanya Chikitsa Siddhanta, which can include Garbhasya Shodhana Chikitsa, Agni Deepana, Vedana Sthapana and Vranaropana Chikitsa, Badana Lomana, Sanya Janana or Vardaka Chikitsa, also Dadu Pushtikaraka and Belavardaka Chikitsa. In this case, Samanya Chikitsa can adopt, but also considering the condition, we should adopt the principles from Pittaja Sanyadushti, Abhighadaja Sanyadushti or Sanyota Jara Chikitsa. So here in this patient, simple protocol was applied, which included internal medications like Sudika Dashamulakwada, Deepyagadi Churna, Dhanvandaram Gulika, Gudujadi Kashayapana Muhurmuhur, and external therapies as Dhanvandara Taila Abhyanga, Snana and medicated water boiled with Nalpamara. So as per modern, even though this is a self-limiting condition, we should be taken care that if it is extending beyond a week. And when we assess in Ayurveda view, we assess based on Roga Parisha and Rogi Parisha. Based on that, we know in this condition there is some dosha vitiation of Pitta, Rekta and Kapha. So here the Sudika Dashmalak Vada was mentioned by Acharya Bhava Prakasha, in which in the Phalasruti Acharya has mentioned that Jwaram Daha Samanvidam. So an associated condition of Pitta and Rekta can be considered here. In that line of treatment, Sudiga Dashimulak Vada was prescribed here. Dipyaga Churna, we know, has the property of Garbhashya Shodhana. And then Vandaram Guliga, we know Sudiga is considered as Shunyagara, and there will be Vada Pragoba. To control that, then Vandaram Guliga may prescribe here. And why Gudujadi Kashaya Pana Muhur Mugur? Because we know in this condition, we know a pitta rakta aggravation is there, and also the stanya is mainly kapha dosha predominant, and also stanya is secreted from sthana, and which is also in the urasthana, which is an area predominant of kapha dosha. So Gudujadi Kashaya Pana was advised. And also when we see the chikitsa of pittaja sanya dushti, drugs or yogas having the drugs of Guduji, Rakta Chandana and Musta were seen. So this yoga is also containing similar drugs. An external application of Taila Binga was based on Samanya Chikitsa Sutra, and Nalpamara was selected here based on the Doshavastha. So while giving the medicine, we always monitored for resolution of the condition, because if it persists beyond 1 week, we should analyze the patient using other investigation. So in this case, the reddish color reduced by day 3, hence encouraged the patient for breastfeeding, explained that the condition is harmless to the baby. And reddish color was completely resolved by day 5, and lactation counseling was provided to the mother, and baby was monitored for feeding adequacy. And here, both baby and mother were discharged on day 6, and follow-up was advised 1 week later on whenever necessary. And when they came for follow-up, they didn't reveal any evidence of neoplastic changes. Both mother and child were healthy, and lactation was achieved successfully. So why is it important to discuss this case? As we know, this rusty pipe syndrome is not mentioned in conventional test books, but it can mimic more serious diseases such as pregnancy associated breast cancer. So it is very important to create awareness of this rare disease among medical professionals and the patients, thereby minimize the rate of misdiagnosis. And also it is very necessary for avoiding unneeded instructions like discontinuity of breastfeeding. So to conclude, rusty pipe syndrome is a benign condition, typically seen in first-time mothers, and proper awareness and reassurance are crucial for its effective management. So thank you all for patient listening. And once again, I would like to thank the organizers of this program and also respected chair of today's session, Dr. Maya ma'am. Thank you all.
Thank you, Dr. Divya on this detailed presentation in a short time. And next, I invite Dr. Mary Blossom ma'am for the case presentation.
Thank you, Dr. Amna.
Thank you, Dr. Amna. Am I audible? Shall we begin the presentation?
Yes, ma'am.
Respected today's chair, Maya ma'am, Suprint, Government Women and Children Hospital, Trivandrum. Respected Anil sir, Professor SFRA. Respected Shaju sir, HOD, Kaumaran Department. Respected Shahina madam, HOD, President of the Department. Faculties, practitioners, and my dear students. A very warm good evening to one and all. Good evening. So today I'm going to share with you a case report on Ayurvedic management on non-healing neutrophilic granulomatous mastitis. Let's quickly move on to the case. A 33-year-old female approached OPD complaining of painful pus discharging ulcer and swelling in the left breast since past 3 months, and also loss of appetite and feverish past 2 weeks. Moving on to the history, her cycles were regular. She had experienced breast tenderness prior to menses since menarche. She had a baby in November 2020 by LSCS. Her both nipples were inverted. She used nipple shield and breast pump for facilitating breastfeeding. 3rd month after delivery, she had severe pain and swelling in the right breast and took antibiotics, and it resolved. Breast pumping and feeding was continued about 1 year. At the end of 1 year, the child stopped feeding from the left breast due to lack of breast milk. However, she continued feeding from the right breast till January 2024. In January 2024, she experienced acute pain, swelling in the right breast, for which she took allopathic treatment and was resolved in 2 weeks. After this, she stopped breastfeeding. Similar lesions start to appear in the left breast with severe pain and pus discharge. A biopsy confirmed cystic neutrophilic granulomatous mastitis in May 2024. Incision drainage was done. Further steroid therapy was started, but the condition worsened. 3 months back, she developed pain and swelling in the left breast. Later, pus-filled abscess appeared and burst out on its own, and pus-filled watery discharge leaked out. She also experienced loss of appetite and feverish for last 2 weeks. She have taken antibiotic treatment almost 4 times in last 3 months, and no improvement was observed. So she approached our OPD, SRPD OPD, Government Ayurveda College, Tripunthura. Moving on to the history, she has no history of past trauma of breast. However, she had hyperemesis gravidarum and GDM during her antenatal period. This is a breast USG taken in 6th March 2024. It shows that ill-defined hypoechoic lesions at 9 o'clock and 10 o'clock positions, which represent abscess, as well as another lesion is there, a hypoechoic lesion and 11 o'clock position, which also represents another abscess. On breast examination, erythematous swelling around the areola was seen. 3 fresh ulcers with pus discharge at 9 o'clock position, 10 o'clock position, and 11 o'clock position was seen. And 1 non-healing scar of biopsy at 9 o'clock position was also seen. This is a picture of the ulcers. I hope the figure is clear. And on palpation, we can see severe tenderness was there, and local temperature was raised, and no lymphadenopathy was noted. And the treatment principle adopted were from Shobha Chikitsa, Vrana Chikitsa, Stana Vidriti Chikitsa, and Nadi Vrana Chikitsa. In the first visit, the following medicines were given: Punarnavadi Kashayam and Amritottaran Kashayam. And further, Kaishara Gugulu, Avipatti Churna was used for Vireshna, 20 grams with hot water twice a week. And external therapies were also given. Triphala Kashaya was used for Shalna and ulcerated area. And further, Jatyadi Varti was applied on ulcer areas for healing. And Triphala Churna Leba was applied on non-ulcer areas. In the next visit, more of Dopana medicines were given and Rekta Prasada medicines were given. So next sitting, they were given with Gugulu Tiktan Kashayam, Padoladi Kashayam, and Gugulu Panjabala Churna, and continued Abhivati Virejana twice a week. In the third visit, so after the second visit, the ulcer started healing in the second visit. So in the third visit, they were given with she was given Gugulu Tikkam Kashayam, Gugulu Panjabala Churnam, and also Triphalak Shalnam was continued. And she was advised to avoid non-veg diet, dadi, masha, amla ahara, and shakkara. And her UST report in after 4 months in 17 September 2024 showed the lesions and 9 o'clock and 10 o'clock position became smaller and lesions in 11 o'clock position resolved. So this was the ulcer before the treatment, and you can see the healing ulcers here. And finally, see, it is all healed. The ulcers are healed. Pain, redness, and swelling has subsided, and there was no recurrence reported since last 8 months. Thank you. Thank you for patient listening. I take this opportunity to thank organizers of the webinar, SFRI and Kaumari department. Thank you once again. Thank you for patience.
Thank you, Dr. Mary Blossom ma'am and Dr. Divya ma'am for grounding today's academic discussion in real-world practice. Your case presentation provided clarity to the theoretical understanding. Once again, I welcome Dr. Maya ma'am to conclude the presentation and share her remarks. We welcome you, ma'am.
I congratulate both Dr. Divya and Dr. Blossom for having done this case presentation, because both of these conditions are quite rare conditions. Like rusty pipe syndrome is also, even though it's a very benign self-limiting conditions, practitioners don't normally get these cases. And many a time, even though benign, these conditions are confused for malignant conditions. Likewise, this granulomatous mastitis. This again is a benign condition, but most often it is, especially in its earlier stages, that is in the earlier years, it was considered to be a malignant condition, and in many cases, even mastectomies were done because these were non-healing ulcers and would not respond to treatment. But now it's more well known and managed more conservatively. But even now, in conventional practice, steroids, antibiotics, wide excision, etc., are usually done. But even in my practice, I have found that Ayurveda can very effectively treat granulomatous mastitis, and it is very important. Such presentations actually, since so many practitioners are listening to this, they also get an idea about these conditions which normally we do not come across in practice. And even modern medicine are quite grappling with, as to how to treat these conditions. Both Dr. Divya and Dr. Blossom has presented has done excellent presentations, and I congratulate both of you once again. And as for concluding the session, I thank the organizers of this webinar for having given me this opportunity to chair the session. And I think after hearing all these sessions, everybody would now be very clear as to how all these interventions play a part in making, or how we should actually intervene. And probably now we have understood that promoting lactation is one of the best and easiest methods for intervening to promote the health of a whole society. And as practitioners, we can unite in doing this again. So thank you all for a patient listening. And once again, I thank all the all the organizers of the webinar for having given me this opportunity. Thank you. Thank you so much.
Once again, thank you, Dr. Maya ma'am, for your remarks. And thank you, Dr. Divya ma'am and Dr. Mary Blossom ma'am for this detailed case presentation. Now we will try to play the video which we were unable to do so earlier. Please be patient.
പ്രോട്ടീൻ ഗീ ഊത്തപ്പം. ആവശ്യമായ ചേരുവകൾ: ചെറുപയർ 1 കപ്പ്, റാഗി 1/2 കപ്പ്, ഉലുവ 1 ടീസ്പൂൺ, ചെറിയ ഉള്ളി 10 എണ്ണം, ക്യാരറ്റ് 2 എണ്ണം, പച്ചമുളക് ആവശ്യത്തിന്, മല്ലിയില ആവശ്യത്തിന്, നെയ്യ് ആവശ്യത്തിന്. പ്രോട്ടീൻ ഗീ ഊത്തപ്പം തയ്യാറാക്കുന്ന വിധം: ചേരുവകളെല്ലാം നന്നായി കഴുകി വെള്ളത്തിലിട്ട് കുതിർത്ത് അരച്ചെടുക്കുക. ഇതിലേക്ക് ആവശ്യത്തിന് ഉപ്പ് ചേർക്കുക. ഈ മിശ്രിതം ദോശത്തവയിലേക്ക് ഒഴിച്ച് അതിനു മുകളിലായി ചെറുതായി അരിഞ്ഞു വെച്ചിരിക്കുന്ന ചെറിയ ഉള്ളി, ക്യാരറ്റ്, പച്ചമുളക്, മല്ലിയില എന്നിവ മുകളിലായി വിതറുക. അതിനുശേഷം 2 സ്പൂൺ നെയ്യും അതിലേക്ക് ആഡ് ചെയ്യാവുന്നതാണ്. പ്രോട്ടീൻ ഗീ ഊത്തപ്പം നിങ്ങൾക്ക് രാവിലെ ബ്രേക്ക്ഫാസ്റ്റിനായി ഉപയോഗിക്കാവുന്നതാണ്. മല്ലിയില ചമ്മന്തി. ചേരുവകൾ: മല്ലിയില, തേങ്ങ, ചെറിയ ഉള്ളി, ഇഞ്ചി, പച്ചമുളക്, ഉപ്പ്. ഉലുവക്കുറുക്ക്. ആവശ്യമായ ചേരുവകൾ: പൊടിയരി 1 കപ്പ്, ഉലുവ 1 ടീസ്പൂൺ, ശർക്കര പാനി ആവശ്യാനുസരണം, നെയ്യ് 2 ടേബിൾ സ്പൂൺ, ചിരകിയ തേങ്ങ ആവശ്യത്തിന്. ഉലുവക്കുറുക്ക് തയ്യാറാക്കുന്ന വിധം: ചേരുവകളെല്ലാം നന്നായി കഴുകി വെള്ളത്തിൽ കുതിർത്ത് അരച്ചെടുക്കുക. ശേഷം ആവശ്യത്തിന് വെള്ളം ചേർത്ത് തിളപ്പിച്ച് കുറുക്കിയെടുക്കുക. ഇതിലേക്ക് ശർക്കര പാനി ചേർക്കുക. നന്നായി കുറുകി വരുമ്പോൾ തേങ്ങ ചിരകിയതും ആവശ്യത്തിന് നെയ്യും ചേർത്ത് ചൂടോടെ കഴിക്കാം. മുരിങ്ങയില ഉള്ളിച്ചോറ്. ആവശ്യമായ ചേരുവകൾ: മുരിങ്ങയില, ചോറ്, നെയ്യ്, ചെറിയ ഉള്ളി ആവശ്യത്തിന്. തയ്യാറാക്കുന്ന വിധം: ചൂട് ചോറിന് മുകളിലായി ആവശ്യത്തിന് മുരിങ്ങയില വിതറുക. അതിനു മീതെ വീണ്ടും ചൂടുള്ള ചോറ് വിളമ്പുക. ചെറിയ ഉള്ളി നെയ്യിൽ വഴറ്റി ഈ ചോറിന് മുകളിലായി വീണ്ടും വിതറുക. കുറച്ച് സമയത്തിന് ശേഷം ഈ ചോറ് വേവിക്കാവുന്നതാണ്. ഉലുവ പരിപ്പ് കറി. ആവശ്യമായ സാധനങ്ങൾ: തുവരപ്പരിപ്പ്, നാളികേരം, ഉലുവ, തക്കാളി, കടുക്, വറ്റൽമുളക്, ചെറിയ ഉള്ളി, മഞ്ഞൾപ്പൊടി, ഉപ്പ്, പച്ചമുളക്, കറിവേപ്പില, വെളിച്ചെണ്ണ. തയ്യാറാക്കുന്ന വിധം: പരിപ്പ്, തക്കാളി എന്നിവ മഞ്ഞൾപ്പൊടിയും ഉപ്പും ചേർത്ത് നന്നായി വേവിച്ച് മാറ്റിവെക്കുക. അതിലേക്ക് നാളികേരം അരച്ചതും ആവശ്യത്തിന് വെള്ളവും ചേർത്ത് തിളപ്പിക്കുക. ശേഷം വെളിച്ചെണ്ണയൊഴിച്ച് കടുക് പൊട്ടിച്ച് വറ്റൽമുളക്, ചെറിയ ഉള്ളി എന്നിവ ചേർത്ത് വഴറ്റി കറിയിലേക്ക് ഒഴിക്കുക. വളരെയേറെ ഗുണപ്രദമുള്ള ഈ കറി ഉച്ചയ്ക്ക് ഭക്ഷണത്തോടൊപ്പം കഴിക്കാവുന്നതാണ്. ചെറുപയർ തോരൻ. ആവശ്യമായ ചേരുവകൾ: ചെറുപയർ 1 കപ്പ്, നാളികേരം ചിരകിയത് 1/2 മുറി, വെളുത്തുള്ളി 2 അല്ലി, ചെറിയ ഉള്ളി 5 എണ്ണം, കടുക് 1/4 ടീസ്പൂൺ, വറ്റൽമുളക് 2 എണ്ണം, മഞ്ഞൾപ്പൊടി 1/4 ടീസ്പൂൺ, ഉപ്പ് ആവശ്യത്തിന്, പച്ചമുളക് 1 എണ്ണം, കറിവേപ്പില, വെളിച്ചെണ്ണ 1 ടേബിൾ സ്പൂൺ. തയ്യാറാക്കുന്ന വിധം: ചൂട് കട്ടിയുള്ള ഒരു പാത്രത്തിലേക്ക് 1 ടേബിൾ സ്പൂൺ എണ്ണയൊഴിച്ച് അതിലേക്ക് കടുക്, വറ്റൽമുളക്, ചുവന്നുള്ളി, കറിവേപ്പില എന്നിവ ചേർത്ത് നന്നായി മൂപ്പിച്ചെടുക്കുക. ഇതിലേക്ക് ഉപ്പ് ചേർത്ത് വേവിച്ചു വച്ചിട്ടുള്ള ചെറുപയർ ചേർത്ത് യോജിപ്പിക്കുക. ശേഷം പച്ചമുളക്, ചിരകിയ നാളികേരം എന്നിവ നന്നായി ചതച്ച് ഇതിലേക്ക് ചേർത്ത് ഇളക്കി യോജിപ്പിച്ച് കഴിക്കാവുന്നതാണ്. കടല തേങ്ങാ ചമ്മന്തി. ആവശ്യമായ ചേരുവകൾ: നാളികേരം, അണ്ടിപ്പരിപ്പ്, നിലക്കടല, പൊട്ടുകടല, ഇഞ്ചി, പച്ചമുളക്, കറിവേപ്പില, ഉപ്പ്, ചെറിയ ഉള്ളി. തയ്യാറാക്കുന്ന വിധം: നിലക്കടല, പൊട്ടുകടല, അണ്ടിപ്പരിപ്പ് എന്നിവ വറുത്ത് നന്നായി പൊടിച്ചെടുക്കുക. മറ്റൊരു ജാറിൽ ചിരകിയ നാളികേരം, ഇഞ്ചി, കറിവേപ്പില, പച്ചമുളക്, ചെറിയ ഉള്ളി പൊടിച്ചു വച്ചിരിക്കുന്ന ഈ മിശ്രിതവും ചേർത്ത് ഇളക്കി ആവശ്യത്തിന് ഉപ്പും ചേർത്ത് അരച്ചെടുക്കുക. ഇതിനോടൊപ്പം കുടംപുളി ഇട്ട മീൻകറി, വെളുത്തുള്ളി, കുരുമുളക്, ജീരകം ഇവ ചേർത്ത് തയ്യാറാക്കിയ ചിക്കൻ കറി, കറിവേപ്പില ചേർത്ത മുട്ട ഓംലെറ്റ് എന്നിവ യഥേഷ്ടം കഴിക്കാവുന്നതാണ്. ശതാവരി ക്ഷീരം. ആവശ്യമായ ചേരുവകൾ: ശതാവരി ചൂർണം 1 ടേബിൾ സ്പൂൺ, പാല് 1 ഗ്ലാസ്. ശതാവരി ക്ഷീരം തയ്യാറാക്കുന്ന വിധം: 1 ഗ്ലാസ് തിളപ്പിച്ച പശുവിൻ പാലിലേക്ക് 1 ടേബിൾ സ്പൂൺ ശതാവരി ചൂർണം ചേർത്ത് നല്ലതുപോലെ ഇളക്കി യോജിപ്പിച്ച് ദിവസേന 1 നേരം കുടിക്കാവുന്നതാണ്. സൂതിക ലഡു. ആവശ്യമുള്ള ചേരുവകൾ: ഞവര അരി 1 കപ്പ്, ചെറുപയർ 1/2 കപ്പ്, നിലക്കടല 1/2 കപ്പ്, ബദാം, അണ്ടിപ്പരിപ്പ് എന്നിവ 1/2 കപ്പ്, ഉലുവ 3 ടേബിൾ സ്പൂൺ, ജീരകം 3 ടേബിൾ സ്പൂൺ, ഏലക്ക 10 എണ്ണം, ശർക്കര ആവശ്യത്തിന്. സൂതിക ലഡു തയ്യാറാക്കുന്ന വിധം: അരി, ചെറുപയർ, നിലക്കടല, ബദാം, അണ്ടിപ്പരിപ്പ്, ഉലുവ, ജീരകം എന്നിവ ഓരോന്നായി വറുത്ത് പൊടിച്ചെടുക്കുക. ഈ പൊടിയിലേക്ക് ആവശ്യമുള്ള അളവിൽ ശർക്കരയും ഏലക്കാപ്പൊടിയും ചേർത്ത് ഉരുട്ടി ലഡു രൂപത്തിലാക്കി എടുക്കുക. ഈ ലഡു നമുക്ക് എയർ ടൈറ്റ് കണ്ടെയ്നറിൽ സൂക്ഷിക്കാവുന്നതാണ്. ദിവസേന 1 ലഡു വീതം കഴിക്കാവുന്നതാണ്.
സൂതിക പാൽക്കഞ്ഞി. ആവശ്യമുള്ള ചേരുവകൾ: പൊടിയരി 1 കപ്പ്, ചെറുപയർ 1/2 കപ്പ്, ഉലുവ 3 ടേബിൾ സ്പൂൺ, ആശാളി 3 ടേബിൾ സ്പൂൺ, ജീരകം 3 ടേബിൾ സ്പൂൺ, ചെറിയ ഉള്ളി 10 എണ്ണം, ഉപ്പ് ആവശ്യത്തിന്, തേങ്ങാപ്പാൽ 1/2 കപ്പ്, നെയ്യ് 2 ടേബിൾ സ്പൂൺ, വെള്ളം 3 കപ്പ്. അരി, ചെറുപയർ, ഉലുവ, ആശാളി എന്നിവ വെള്ളം ചേർത്ത് കുക്കറിൽ നന്നായി വേവിച്ചെടുക്കുക. ശേഷം 1/2 കപ്പ് തേങ്ങാപ്പാൽ കഞ്ഞിയിൽ ചേർത്ത് ഇളക്കി കൊടുക്കാം. ഇനി ചെറിയ ഉള്ളി, ജീരകം എന്നിവ നെയ്യിൽ നന്നായി വഴറ്റിയതിനു ശേഷം തയ്യാറാക്കി വച്ചിരിക്കുന്ന കഞ്ഞിയിൽ ചേർക്കാം. ആവശ്യത്തിന് ഉപ്പ് ചേർത്ത് സൂതിക പാൽക്കഞ്ഞി സേവിക്കാവുന്നതാണ്.
It would be very kind of you if all these recipes may be shared in English.
We will share this recipe soon. The detailed recipes will be shared either through the WhatsApp or Gmail tomorrow itself. Next, we have a video presentation by Kaumara Britya Department on Stanya. Stanya Parisha demonstration will be presented now. We once again apologize for the technical interruption. Thank you for being patient with us. With that, we conclude day 2 of the journey, celebrating and strengthening breastfeeding support through Ayurveda. We express our sincere gratitude to each of today's speakers, Dr. Jyoti ma'am for highlighting the importance of preconception care, and Dr. Rajita ma'am for her valuable insights into antenatal interventions, and respected Dr. Shahina ma'am for her thoughtful guidance on postnatal support, and Dr. Divya ma'am and Dr. Mary Blossom ma'am for connecting theory to clinical reality. A special thanks to Dr. Maya Balakrishnan ma'am for chairing today's session with her esteemed presence and continued support in Ayurvedic women's health education. Thank you to all our participants for your energy and engagement. We will meet again tomorrow for day 3 as we explore pediatric conditions, Stanya Dushti, and pharmacodynamics of Stanya-related drugs in Ayurveda, along with practical demonstration that promise to be both insightful and inspiring. Wishing you all a restful evening ahead. Thank you all.